endoscopy assistant at the hospital in Zanzibar. He is also QI teacher person and TBQI secretary at the hospital. He earned his medical degree at the University of Health and Allied Sciences. Title of this presentation is How TASAC Hospital has revolutionized healthcare industry with minimum invasive surgeries. You're welcome, Jackson. You have 10 minutes.
Good afternoon. I'm Dr. Jackson from TASAC Global Hospital, and today I'll be talking how TASAC Hospital has revolutionized the Zanzibar healthcare system with minimum invasive surgeries. So I'll take you through who are we, fact checks, what we do, the minimum invasive surgeries in TASAC Hospital, the bariatric surgeries that we are now doing, as well as where we are located. So first of all, we'd like to pay a tribute to the late Mr. Sari Turuk, who is the founder of the hospital, as well as a group of company in Viga, Zanzibar, for his work that made sure that the hospital stood in 2015 till to date. So who are we? TASAC Hospital is a highly specialized hospital, multidisciplinary hospital that is based in Zanzibar, located in Stone Town, just 5 minutes from the airport, with a large team of specialized, competent, experienced, as well as professional doctors, with modern facilities, as well as quality state-of-the-art in technology. We aim at providing the finest and the best healthcare services to all domestic as well as international patients. So, what is TASAC in numbers? So, we attend almost 400, 500 clients served daily. These are outpatients and inpatients with 1 bed capacity in patients. We have the intensive care unit in place. We do minimum invasive surgeries as well as endoscopy studies with 7 dialysis beds as well as diagnostic. Where we talk about big to X-ray, CT scan, mammogram, stress ECG, echocardiogram, endocorporeal, shockwave, lithotripsy, as well as sonograph, as well as laboratory studies. So we have more than 12 specialties at the hospital with the emergency services that work 24/7 throughout the week. We have ambulances placed in different parts of Zanzibar. We know Zanzibar is huge, so for those people need these ambulance services in the dialysis units, more than 20 specialists. We do laparoscopic procedures, we do endoscopy studies, also attend outpatients as well as inpatients. So these are some of the specialties ranging from hematology, anesthesia, as well as critical care, gastroenterology, cardiology, orthopedic, as well as physiotherapy, surgery, urology, endocrinology, nephrology, obstetric and gynecology, pediatric, dentistry, ophthalmology, ENT, as well as dermatology. So at our hospital, we are accepting different types of insurance from our clients, from the National Health Insurance Fund, as well as other insurance such as Strategies, Assemble, Jubilee, and Vita, and more, as well as local insurances in place. But we also accept international insurances for tourists, such as Resolution and Antenna Signal, and more. So, the topic of today, how TASAC Hospital is enhancing the healthcare industry with minimum invasive surgeries. So, we can say that we are pioneers in Zanzibar Island, because we are the only facility currently doing laparoscopic or minimum invasive when it comes to gastroenterology. So, what are the minimum invasive surgeries? We say, in contrast to the classical or traditional surgeries, minimum invasive surgeries, these involve techniques that limit the size, the size as well as the number of cuts or incision, where a special equipment or small equipment are placed through the pods that are made, and with help of this, we are able to do diagnostic, we are able to treat, and to go further. So, with minimal invasive surgeries, we say small cuts makes a big difference. So, what are the advantages of minimal invasive surgeries? Less pain for those who undergo this, say less bleeding. There are less hospital stay. Means these people who undergo this, they may stay in the hospital 3 up to 4 days. Some may even go on the same day, and some of these procedures may be even done as an outpatient. Also, cosmetic scars, contrary to the traditional or the open surgeries with minimal invasive surgeries, there's a limit or size of the scar, so it's essentially cosmetic, as well as increasing safety, and they are less costly, or we can say they're cost effective. So, what is the milestone of minimal invasive surgery in Zanzibar? Prior to 2013, there was no any minimal invasive locally in Zanzibar, but after 2023, the government of Zanzibar, has, with the collaboration of Chinese government, periodically they started bringing doctors for endoscopy studies only, and as well as laparoscopic, with time to time where they come back. So in 2017 is where a medical gastroenterologist joined the Nazi Mondia National Hospital. So it was limited to endoscopy studies, means upper endoscopy as well as lower endoscopies. In the Tasata Hospital 2020, we had the first gastroenterologist joined the team. Is when we started full implementation of the minimal invasive surgery. So, about the hospital itself, what we did and what we achieved, and also we published this, we were able to do a laparoscopic cholecystectomy to a pregnant woman, 20 weeks of gestation age, who had acute calculus cholecystitis. So this is one of the biggest achievements that we were able to operate, as well as we understand the implication of this disease in pregnant women. So, in terms of statistics, we do 20 endoscopy on average every week. This including both upper and lower endoscopy, means OGD, as well as colonoscopies, where we have 2 days, Tuesday as well as Fridays, for these studies. So in terms of laparoscopy, what we have achieved for the whole patient that we have operated on, or who undergone minimal invasive surgeries, more than 37% of these patients underwent cystectomy. This due to ovarian cysts, could be due to renal cyst as well as hepatic cyst, but a large number also was appendectomy, laparoscopic appendectomy due to appendicitis. 28% underwent cholecystectomy, 24% laparoscopic, as well as splenectomy. For most cases, we had almost 1.6 for sickle cell patients who have splenemia, and 7.9% of these were diagnostic laparoscopic, means we are trying to find what's wrong with these patients. So, in terms of minimally invasive surgeries, what we do, mainly we do laparoscopic appendectomy for appendicitis, we do laparoscopic cholecystectomies for diseases related to the gallbladder, cholecystitis, cholecystitis, also splenectomy. We also deal with ovarian as well as renal cyst, including hepatic cyst, inguinal hernias. Currently, we are doing laparoscopically, as well as we do diagnostic laparoscopically, as well as adenolysis. So this is one of the imaging together with our gastroenterologist, Dr. Alexander, and I performing a laparoscopic cholecystectomy in our facility. So also another thing that I would like to talk about to you that we are doing at our hospital is bariatric procedure. What are the bariatric procedures? These are non-invasive procedures that are mainly for people to reduce weight, for those who traditional means have failed, means diet has failed, exercise has failed. We know that obesity is the risk factor for major disease, heart disease, diabetes, hypertension, stroke, kidney disease. So for people who are obese and really want to reach this target, we have introduced what we call the intragastric balloon that we do. We are the only one doing it in Zanzibar. So how does it work? So this is the temporary non-invasive surgical weight loss procedure, which involves insertion of a special balloon. What it does is that the balloon, once placed in the stomach, it reduces the volume of the stomach and makes this person eat less. In such a way, it takes a period of 6 months to attain almost 10 to 15 to 20% of the current body weight loss that is present. What you see on the image is one of the balloons that we have placed. So far, we have a success rate of 100% with no complaint or any patient who has came for a vision of this. So these are our contacts, and we are located in Zanzibar. You are all welcome in Zanzibar. Thank you.